All right, welcome to another episode of our podcast. Today, we are talking about a fresh approach to the challenges with patient care. My name is David Labine, founder and CEO of ResTech Solutions, and I'd like to welcome today's guest, Bryce. So, Bryce, I'll give you the floor to introduce yourself.
Hi, as David mentioned, my name is Bryce Ashmore. I've been in healthcare for about 15 years. I own a home health agency and been in an RN for several years, I think about 12 years, and have worked in many roles as a RN from bedside to administrative. So that's about it. I'm located in Northern Virginia area.
All right, well, glad you're able to join us today.
Thanks.
All right, so we'll go ahead and jump right into our topic for today. So, the health industry is constantly evolving, especially when it comes to maintaining high standards of patient care while balancing compliance and operational efficiency. From your perspective, what are some of the biggest challenges home care providers are facing in 2025 when it comes to delivering consistent, high quality patient care?
With delivering high quality patient care and home health is, to me, one of the biggest challenges is meeting the client, the patient, and the family with what their needs are at their level, at the complexity, or at the, because each client, each patient has their own dynamics, and every family has their own dynamics. So you're not really only coming in and fulfilling the needs of that client, of that patient, but you're also filling the needs of that home. And there's different types of home health. There's long-term services, and so, for instance, there's a with skilled services, say with physical therapy or OT. You go, say a physical therapist is going in for an hour or hour and a half, whatever the order might be, and then they're leaving, or a nurse for wound care, and it might takes a short term or a short period of time. But there's also we have a client who has they require longer throughout the day care, so they're actually approved for 24-hour care, but they're really just we're only there for 8 to 12 hours a day. But in that instance, we're really kind of seeing what is the needs of the family also, because it's just not meeting that client's specific needs for that specific hour. Dynamics of the situation, and also the complexity of the patient's health, because it varies a lot, and you really have to be thorough. Also, you have to be diligent with the orders and with the patient's history and what is going on, to how the patient presents, because there can be a mentality of, well, the patient's at home, but they're not in an acute setting. So they're not really maybe being as diligent to assessing the patient as well as you would in a hospital setting or something like that. And so it's really pushing to make sure that that quality of care is being given in a home setting also.
All right, well, perfect. I appreciate the insight.
Yep. Yeah.
So let me ask you a little bit, kind of more about your business. So can you tell us some more about Nest Home Care? What inspired you to start it, and how does your team approach patient care differently from other home health providers?
What inspired me to start it is because I was a director of nursing in a home care agency. And while doing that, I was noticing a need for a higher quality of care with clients. And those were the agency I was working with at that time. They were dealing specifically a lot with families with pediatric clients. And they were, there was a gap, so to speak, with building that relationship with those families and providing that quality of care. Instead of, it felt like there was more of just putting a clinician, or putting in a nurse, or putting in a non-skilled caregiver, and just collecting that claim. So while I was there, I just kept on noticing a turnover of families were switching from provider to provider to trying to find that provider that would fit the needs of that client and that family. And so I really wanted to break off and start my own, to be able provide that higher quality agency and to meet that family's complex, but to meet their needs at their level so that there was no how do I say, there was nobody left behind, like, because if I wasn't just coming in and looking at the client, but I was coming in and looking at the home as a whole, and trying to help. So a year and a half ago is when I or April of last year is when I got started, when I started Nest Home Care. And that's the reason why, is because I just saw the need that was out there, and so I wanted to be able to provide that higher quality.
All right. Well, no, that's pretty amazing. It's always interesting to hear people's journeys, how they got started, and kind of where they're passionate about, and what led them to where they are currently. So I appreciate that.
Thanks.
And so you've talked a bit about kind of like the quality and the standards. So how do you ensure compliance and quality standards remain consistent across your business, especially as regulations and technologies continue to change?
Try to continuous feedback with our staff, and also being diligent with our relationships with regulatory agencies, being able to look at constantly looking at OIG or CMS, and making sure that, or in the department, whatever state that you were, any providers working in. Ours is in Virginia, to be diligent in applying those changes that are they're implementing in your state, to make sure you're communicating that, and not only that, but you're going out and conducting those checks with your staff to make sure they're being implemented in the way that they should, and holding them accountable. So, and also providing just a positive relationship with the staff, so that there's a feel of support from the administration to implement that change whenever, because change is a constant, ongoing thing in healthcare, as anybody knows, in healthcare. So it can be frustrating. It might feel frustrating at times, but with the support from us, from the staff, the staff will feel like, hopefully the staff is feeling like it's not as cumbersome as other places.
So I know there's a lot of parts really to any kind of healthcare or medical practice or business.
Hmm.
So how are you balancing the administrative compliance and patient focused sides of the business so everything is getting the attention that it requires?
Really, by prioritizing each day, and by making sure that I'm not prioritizing and structuring my days, basically, and making sure that nothing is falling through the cracks. And I have to be able to delegate, as I should, as an owner, and be able to be okay with that whenever I need to ask for assistance, and identify areas where I do need assistance, is a big one. For an example, recently I brought on an external vendor, to help with claims, because it's just, as a clinician and somebody, I worked in compliance in my background. I had some compliance and a bit of quality. However, I never had to worry about submitting claims and things like that. And whenever I started trying to complete my claims, I first was hitting a lot of walls, and I was getting through them, but it was very time consuming. And so I had to reach out to a consultant, and so being able to identify, like I said, just being able to identify the areas where I'm not the strongest, and be able to, and finding support in that area, and then also trying to even strengthen more the areas where I am strong at, and moving forward, definitely prioritizing each day, and knowing what needs to be done each day, is a huge, because if not, I find myself just kind of turning and not moving forward, because I would find that I was just doing work, and not making progress. Not You kind of lose that growth mindset if not.
Yeah, it's real easy to find yourself doing busy work and have the illusion of being productive versus doing what's the true productive pieces.
Very, very, yeah. Well said.
All right. Well, perfect. I appreciate the insight. And so I know you've alluded to a lot of kind of your background throughout your career, and from what I've seen, kind of doing my research, it's obviously been a very impressive career that has spanned clinical care, compliance auditing, and administration. But what aspect of your current role as owner and administrator brings you the most fulfillment day to day?
Really, still the most fulfillment day to day is uh, finding solutions to problems for others. Like today, I was speaking with somebody that they mentioned that they were applying for waiver services in Virginia. They have a thing called waiver services where is through Virginia Medicaid, and they were applying for a certain waiver service for their child, and that specific service takes years, and they were unaware of another that only takes usually a couple months to get applied and get that completed. And it really gave me a lot of joy to be able to inform them and then reach back out and connect them with the right people. And potentially I might be able to work with them in the future to provide services for them through those waiver services. And if that happens, that's great. And if not, that's okay too. But the true joy is finding that solution for her because she was stuck in a spot and she needed some help. That's really what from day to day. That's the win for me is finding those solutions for people.
All right. Well, that's phenomenal. I really enjoy when people are able to do that for others. So that's pretty cool.
Yeah. Yep. Other seeing the company grow, that's the next best thing I would say too. Because over the last year, it was slow at first. It was quite the grind, but it has starting to get some more traction and starting to get some good reviews and things like that, as any small business would want. And that has been something that you can see that I'm sure you can relate, that you can see that you built and it's growing, and you can see it's a product of your efforts is very worthwhile. It's something that you can feel good about, and so that's something else that I do enjoy.
All right. Well, perfect. So as we kind of transition here towards, as it comes to the conclusion of our episode here, wanted to ask about, any initiatives you may have going on. So are there any current like initiatives or major initiatives or improvements that you're currently focused on right now within Nest Home Care, whether that's in patient care delivery, compliance processes, or technology adoption?
Probably the next initiative would be just growth and expansion. I think I have all the processes in place. I have my and claims vendor and things that just for the daily the daily operations. And so now my goal is to grow at a healthy rate. I don't want to get myself in a bind so that I cannot provide quality care for any client. But at the same time, I do want to grow. And so right now, we provide skilled and non-skilled. We don't provide. I don't currently have any therapy. We don't provide Medicare. That would be down the road. It's required to take on 10 pro bono patients, and to do that, and I'm just not there yet. However, I would like to expand maybe to a different location in Virginia. It might be like near the coast in Virginia Beach area or something like that, and open up a second location. That would probably be my next goal, is just to expand, and just from there, once I'm able to do that, it would be to continue to have a diversity of services and hopefully be able to provide that therapy services. I'm licensed to do so already, but really those fall in place once you're on board with Medicare. Those usually are not coming from Medicaid or private pay. So expansion and doing it at a healthy rate, at a healthy growth.
Okay. And so as you are looking to expand and also knowing what a lot of other healthcare organizations or practices are doing this year in terms of reevaluating their data protection and compliance strategies, especially the items around HIPAA and cybersecurity risks,
hmm
how is your team currently managing those pieces, such as the data security and access to sensitive information within your systems?
But right now we're pretty small, and so it's a pretty limited uh, exposure, I guess you would say. And so we're doing everything just in house within ourselves. As we grow and we do expand, I will have to reach out to somebody such as yourself, or to have that extra security to ensure that. But fortunately, within my last compliance role, I was able to bring on some good resources, and I know it doesn't cover all the IT security side of everything, but like I said, we're pretty limited with the number of clients we have right now, so we're not really putting too much out there security wise, but would that will come in time. I know that, so we'll have to reach out to somebody for assistance with that.
All right. No, I appreciate that. But as we wrap up here, are there any final thoughts you'd like to share or leave the audience with?
No, no, it's been a pleasure discussing this with you. It's great to talk with other professionals out there and just to be able to discuss healthcare and the challenges. And I appreciate your time.
Yeah, well, thank you. I appreciate you coming on as well and sharing your insights. Excited to see kind of how you continue to grow your business as well. Sounds like there's some exciting things ahead. And for anyone who's watching that would like more information, all the information will be below the video in the description.
All right, thank you, Deb.
All right. Thank you. All right. You're welcome.